I see you've noticed my disorder. I have a stillborn fetus growth attached to my head.
Weird growths, inappropriate medical conversations, and chaos breaks out on the town hall. Today, we are back at it, breaking down and reacting to the laughable medical scenes and over-the-top injuries from South Park. All right, let's dive right in.
Hey, Stan the man. How you doing, buddy?
I laugh because I have done this too. You try to be cool, you try to relate. I guess I try to, depending on the situation, the chief complaint, why somebody's there, try to make them laugh. It's actually my #1 go-to.
The nurse said you came here by yourself, no parents?
I kind of wanted to talk about something in private.
Oh, okay, pal. What is it?
I think I might be horribly racist.
Okay, so he is wondering why he is racist. Stan goes to the doctor. He's underage. As an ER doctor in situations where minors come in without an adult, the law says if there is a life-threatening injury or event that's going on, you treat and make sure that the individual doesn't die because there's implied consent. It's good that the kid's going to a doctor for a resource to help. Maybe not the appropriate setting for what he's asking, but he just wants to know. He doesn't know where to go.
There's this kid at my school, and he's black. And his parents named him after the guy that wrote Lord of the Rings.
Uh-huh, Tolkien. Great name.
Yeah, well, I thought his name was Token. Like a black kid that's just there so that, like, there's a black kid.
Uh-huh. And how long have you thought that?
The whole time. I've thought that the whole time.
Poor kid.
Wow. You.
Oh my gosh! Probably not an appropriate response from adult to a kid. The kid literally is doing the appropriate thing of admitting that, you know, the way his brain was thinking and going down that wrong, thought process. The big thing about being a physician is a patient to doctor relationship. For me as an ER doctor, we have to develop that relationship very fast and have to have trust immediately.
Get out of my office! You make me sick!
I'm sorry!
Wow.
I don't know what's wrong with some people. I thought I told you to get out of my office because you seriously make me sick. I'm gonna shit my pants right now.
Doctor, please, I don't want to be like this. I'll do anything. Just tell me what to do.
Well, you want to change? Then I suggest you start doing a lot of reading.
The way that this doctor totally approached the situation was so wrong and not appropriate. People don't respond to being yelled at. So if you're having thoughts as an individual where you don't think they're the right thoughts, or you feel like, the way you're thinking is maybe wrong, you need to talk to somebody about it. But then who do you talk to? Different types of therapists out there that you can talk to. There are social workers, school counselors.
Ow, my nose! You broke my nose! Damn, Pip, I didn't know you had it in you. Oh, I'm dreadfully sorry.
That nose is bleeding pretty bad, Kyle. I think you might have to go to the nurse's office.
Oh, geez. Nosebleeds are super common. The best way to stop it is pinch the nose, the soft spot, and lean forward. Typically, nosebleeds occur in 2 areas. One, there's an anterior part of the front of the nose where there's a bunch of blood vessels that form this area called the Kesselbeck's plexus. If it's a posterior, further back, what ends up happening is you're now holding a reservoir and you're allowing the blood to kind of pool and it'll form a clot. And when you form a clot, that's a good thing because then it'll eventually stop bleeding.
Oh. Whew.
Now, what seems to be the
Oh
problem?
gosh.
I just hit my nose playing dodgeball.
Oh, well, I'll get you an ice pack. I see you've noticed my disorder. I have a stillborn fetus growth attached to my head.
The kid's response is hilarious. Okay, just so there's no confusion, this stillborn situation would have occurred in the womb, meaning inside the uterus. Stillborn means that it's not living anymore. Wouldn't you have that removed? Back to his nose. If he broke his nose, most of the time you don't do anything to treat it. Most of the time it's fractured, which means broken, but it's not displaced.
And so I'm suggesting that this town puts all of the...
Oh!
Holy shit!
Randy?
Oh my gosh, okay. Right upper chest is your lung, bones, soft tissue, some major blood vessels that are coming off of the heart, what we call scene safety, and get the individual out of a scene where more detrimental things can occur. Oh my gosh. Hell's Pass Hospital.
I'm sorry, but he's in critical condition.
They're in Colorado, right?
Who shot him?
Pass.
Nobody knows.
So interesting, the doctor's coming to the family in what appears to be the regular like lobby waiting room. What ends up happening in the trauma facilities that I've worked at, usually there's police involved and the police are actually there on scene at the hospital. Typically patients are not registered under their own names. It's like a code because you don't want, you know, somebody's looking for them to hurt them. If a family does show up, you actually put them in a family room. That way you can discuss so nobody else hears what's going on.
Be okay?
He's in a coma. He's unconscious and just blabbering nonsense.
Typically as physicians, we don't use coma. We try to describe it more because coma is such a non-specific term, meaning like sleeping. Are they sedated from the medications that we're using? But then the doctor says here that the spurting gibberish. So they're not necessarily in a coma per se because they're actually talking, but they might be delirious, altered, those sorts of things. So I see a bandage on the arm, so maybe you didn't get right upper chest, maybe arm, which typically, if you're shot in the arm, shouldn't cause somebody to be unconscious or requiring sedation at the hospital, unless the bullet tracked into the chest cavity and caused major issues there.
Mr. Marsh, your whole family is here. Your wife, your daughter, and your son. Konnichiwa!
Sometimes stress can cause a lot of significant speech changes, could cause somebody to have so many different reactions. But our job first is to rule out any identifiable cause outside of stress and anxiety that would cause these changes.
Timmy, I told you, put on the hat!
I mean, those types of crutches, braces are actually metal and cause a lot of trauma and damage. So there's other ways to resolve conflicts other than just fighting. And you never know. You can actually cause severe head trauma, bleeding in the brain, skull fractures, a lot of different things that can occur, smacking your head on the ground. Literally, that kind of fall can crack your skull open, can cause bleeding in your brain, and can potentially kill you. And it's not even that great of a fall. Great meaning like height. Humans can actually bite fingers off. It takes the same amount of force as biting a carrot. I've yet, in my many years of being an emergency medicine physician, have not seen a finger bitten off. It can cause a lot of pain, yes, and increase the risk of infection because of the bacteria that's in a human's mouth. Okay, and again, somebody's paralyzed. Do they have sensation and feeling? So that he's getting hit in the groin. That depends on where on the spinal cord there's issues. Is it just a motor function problem? Is it a sensory issue? It just depends because the spinal cord is so complex. The nerves for these different types of feelings are in different areas. I enjoy doing this. It always brings up some tough conversations to have. If you guys enjoyed this, definitely binge watch this playlist right here. And as always, make sure you do me a favor. Subscribe, hit that like button, and turn your notifications on. Thank you so much for watching and stay healthy, my friends.